today this case discussion by Dal Al-Awishir, supervised by Dr. Anwar. Okay. 40-year-old male. He presented with bilateral lower limb cramps for the past 6 months. Okay. The cramps always comes after waking up in the morning and lasts for 1 hour, relieved by itself. What do you think?
What other questions you would like to ask?
Only in lower limb cramps? Not other parts?
Bilateral lower limbs.
Clarify.
Okay.
Clarify. What do you mean by cramps?
Okay. The patient, he was having almost the cramps was having it's like tightness in both lower limbs below knees. Okay, and it was bilateral, always in the morning, last for 1 hour, relieved by walking. Okay, and it wasn't aggravated by anything. No jerky movement during sleep. The problem is not at the initial of the sleep, it's only in the early morning. Okay, not associated with the redness or swelling of the leg or hotness. Patient denied any muscle exercise, exercise or muscle overuse in the past 6 months. Okay, and he came many times to the polyclinic. He was given muscadol, and it wasn't relieved.
So when we took the clarification, we were aiming for something, few things. We were looking for differential diagnosis. So what differential diagnosis you would like to put in your mind for a patient who's coming for 6 months complaining of bilateral muscle cramp?
هو مفيش ميديسين؟ no history medicine معين بياخده؟
ما في. Drug history كان negative.
Okay, so one cause can be medication. What medication you think in your mind that it can cause?
Statin مثلا.
Okay. 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 So we were thinking of some medications that may cause muscle cramp or muscle cramp, but the patient didn't have any history of. Okay, so you were thinking about that it could be an exercise induced, and the patient denied that he had doing an exercise.
مثلا.
في electrolyte imbalance. Electrolyte imbalance.
Electrolyte imbalance. And how in the symptoms you would like to ask about electrolyte imbalance?
يعني history مثلا chronic diarrhea أو vomiting.
Okay.
ممكن
palpitation.
history مثلا hemorrhage أو bleeding.
Okay. Yeah. Okay. فممكن يعني daily. Okay. So you were thinking about maybe electrolyte imbalance, and these are the questions that you may ask to rule out any electrolyte imbalance. And the answer is Dalal.
He denied any exercise, any drugs, and any GI symptoms, urinary symptoms, even cardiac symptoms he doesn't have. Regarding the DVT declarania, he didn't have swelling or redness or hotness.
Okay, so in the differential diagnosis, you've been thinking it could be maybe a cramp due to a DVT or other things like claudication. Could be is it a claudication? Although the cramp is early morning, so it doesn't go with the claudication.
Relieved by movement.
And relieved by movement, so it doesn't go with the claudication. Okay, and for the DVT, he denies that there is any swelling or any redness or hotness in the lower limb. Okay, any other things you would like to ask or in your mind about the differential diagnosis? Varicose veins, okay, it can also cause.
He denied any color.
And in the examination, maybe we'll tell you later about it. But from the history, there is no, it was negative.
Obese?
No.
Okay, طبعا this is an examination again, but from the beginning we
في
can.
back pain ممكن refer the pain من the back.
Yes, excellent. So it could be a back pain. Okay, something in the spine that could be. Okay, so Dalal, any.
This one I missed.
Okay. So what type of pain that when we call that it is a back pain, referred pain? What kind of pain or what diagnosis you may think about when you are thinking about a referred pain from the back? What you put in your mind?
lumbar sciatica.
Yes, it could be a sciatica. Okay, so in the history you would like to ask about?
يعني pain
Okay, numbness.
pain radiate to
طيب.
back or side or
Yes,
side,
the back,
side.
the back pain starts from the back and then descend into the lower limb. Okay, and other things, and to the lower limb maybe to the extent to the foot. Okay, so numbness, back pain to the legs. Okay, anything else? Incontinence when it is a severe neuropathic. Okay, and weakness. Weakness. Lower limb weakness could be also related. You didn't ask about any back pain that radiate, or the pain, it was only in the calf, or it
Only
is
in the calf.
only in the calf. So he denies that there is a pain that from up to down.
No, it's
Okay, so there is no. She didn't ask about the back pain itself, but she asked about the pain, what it is, and he said that it is only in the calf, and it is not from up down. Okay, so this means that the issue of having disc prolapse or sciatica, it's not appropriate. Okay.
Vitamin D.
Okay. So in the differential diagnosis, we may think about metabolic, like for example vitamin D. Usually vitamin D comes with what history you would like to ask?
لا جنرال ما يرجع.
Yeah. Yeah.
عشان كده مش فيتامين دي.
Yeah. So it's ماشية أكثر مع لو إحنا فكرنا في الفيتامين دي deficiency إن تكون البين جنرال ويكون fatigue, bone pain.
ونوت ريليتد فور ذا تايم يعني مور.
Yes. Yes. The timing مو ماشي. Location of the pain مو ماشي. Okay. So now we are excluding many of the differential diagnoses. Okay. Now after clarification, you are looking for differential diagnosis. At the same time, you are ruling out. Yeah, we will. Yeah, we will. She want to ask about psychosocial, and we will come to this. But before that, before going, after we finish clarification, then we want to rule out serious conditions. Yeah. So the next part of history is the red flag to rule out any serious conditions that can cause a muscle cramp in the lower limb. And she ruled out.
There was no fever, no claudication, no cold extremities, no polyarthralgia, no shortness of breath on exertion, no GI symptom, no urinary or respiratory symptoms.
Okay, so the history, the clarification of the symptom itself, we took it. Then we go for clarification, for red flag, I'm sorry. And now she went for other history, like?
Regarding the past medical, past surgical and drug history, family history, all were negative. Okay, ending this by asking about the psychological, as Dr. Mariam, she was interested in.
What social history
Social,
you would
I
like
mean.
to ask? Job. Okay. Anything else? Marital history. Okay. His job is marital. Why? What does it affect? He's a male. Yes.
40-year-old male.
How these things that can cause the muscle cramp?
Standing for long time.
Okay.
Heavy worker.
Okay. So the job. Anything else? Okay.
بس ده مين؟
Okay. Okay. But maybe stress. Maybe. Okay. Okay. So what social history we have, Dalal?
Okay, he is.
What's the psychological? We go back for the social.
Okay,
Yes.
social history. He's non-smoker, married. He's a father of 3 children. Financially stable. He is a social worker in charity association.
So he's in a charity جمعية خيرية. يشتغل في جمعية خيرية. So his job is mainly sitting. He's not standing. Okay.
Okay, he came from Africa 6 months ago. Since then, he was having this problem.
Okay.
Okay, and this problem is affecting his life because it's affecting on his concentration during at home and at work. Okay, and also the stress of his work is making his condition worse, making the cramps worse.
Okay. Okay. Any hands?
Financial history.
He's stable. He's working in the charity. يعني هذا هو stable.
Psychological يعني.
Okay.
Psychological problem.
What psychological problem you would like to rule out?
anxiety هم اثنين.
Okay. Okay. So how can you ask about, if we want to ask about depression?
الدكتورة مروة تقول بعد post traumatic.
كنت الدكتورة كانت بتقول post traumatic. Good. Okay. So which is the type of anxiety? Okay. So either anxiety or depression. How can you rule it out? Depression.
الميجور
Yeah, the mood.
والانترست والكونسنتريشن والهايبرسوميا والانسوميا
Okay. So what he had?
Okay, for the he was having the mood is normal, okay, and he has interest in life and his family. He's okay. He's having a flashback of the poor status in Africa. Okay, and I did generalize the JAT7. I did it for him, the questionnaire. Okay, and his score was 16. After many visits to rule out physical causes, I referred him to the psychiatric outpatient to rule out generalized anxiety disorder.
So وكان يتشخص دائما انه مصري كرام and given mosquito for the 6 months and no relief.
GAT7 was measured for the patient.
هو طلع 16 سبي اوكي فهو more than 10 high possibility
High possibility.
mild to 10 moderate to 15 severe.
severe اوكي so فهو طالع 16 يعني most likely انه هو يكون generalized anxiety disorder وانه يكون severe condition and she referred him for the psychiatry clinic and they
He came back وقال لنا he came back with a diagnosis of generalized anxiety disorder. He was supposed to be on SSRI, but he refused the medication, and he is now on psychological treatment.
cognitive behavioral therapy okay
ICE, when I asked the patient about idea, concern, expectation, he didn't have an idea, but he was thinking of maybe it could be a serious condition. Okay, yeah, and he was putting in mind like some of his friends telling him maybe it's a DVT, so that's why he came like to run some blood tests and more investigation. Okay, although his lab test, we did all lab tests before we send the patient to the psychological. We looked for CBC, ASR, full profile, CRP, CK, LDH, all normal.
when this case was raised يعني لما كلمتني عنها دكتورة دلال I was asking what PICO question we can raise from this case. البيكو تذكرون اللي هو patient who is my patient, what was the intervention and what is the compared intervention and what was the outcome that we want from this case. So I've been thinking what was the question that we may raise from this scenario. طبعا البي سهلة. The patient was a 40-year-old gentleman complaining of bilateral lower limb cramp for the last 6 months. The intervention, we have two way of intervention. يمكن the patient was little bit يعني delayed in his يمكن diagnosis معنا 6 أشهر لأن احنا عشان to diagnose anxiety actually we need this duration. لما نقول 6 months. بس from the initial time to think about psychological, we need to think about how can I differentiate that this is really an idiopathic, which is the intervention. Shall I diagnose him as and treat him as idiopathic muscle cramp? That is without reason, and it is the most likely, actually, diagnosis. Or shall I look for secondaries, and while considering also the triple diagnosis as a way to reach as a treatment option? And the outcome, of course, we need a relief of the muscle spasm. So أنا يعني كنت أفكر أو كنا نفكر مع دلال إن there are two way. ليش من البداية إحنا ما نقدر نحدد إن this is idiopathic؟ هل نقدر نحدد من البداية إن this is idiopathic ولا لا؟ علشان to search for secondaries نقدر ولا ما نقدر؟ This was a question.
يعني we rule it out يعني تكون يعني we rule everything out وبعدين إذا ما لقينا شيء فنخليه.
اوكي فاحنا كان الاشيو انه we want to know this is idiopathic اول شيء فاذا انا لازم اول شيء اعرف is it an idiopathic muscle cramp واذا لقيت علامات هني تقول لنا this is not an idiopathic then I will go for the comparison which is the secondaries. I would look for secondaries. فلازم انا اول شيء اعرف شنو هي الايديوباثيك muscle spasm لان لان هذا راح يسهل لي في المستقبل ان انا لو عرفت من هم الايديوباثيك then اي واحد يجي له symptom not from the idiopathic muscle spasm I would dig on and I would يعني مثل ما نقول اصر والح ان انا القى possible secondary. Okay, and for that then we will put the differential diagnosis. And for the idiopathic muscle cramp, if you want a definition or how can I reach this idiopathic muscle cramp, and this is from the BMJ best practice from 2015, there are special criteria. If you find this criteria in any patient, then this could be most likely an idiopathic. Okay, first of all تكون nocturnal inset. والpatient هذا عندنا لا it's more toward an early morning. تكون في الgastrocnemius involvement with or without foot involvement. هني positive or negative بس عنده شيء مو موجود negative هو عنده not nocturnal onset. Duration إذا كانت أقل من 10 minutes it's idiopathic. إذا كانت more than 10 minutes more than or equal معناته it's more toward organic or secondaries. والpatient مالنا عنده for an hour. So this is an alarm that idiopathic muscle spasm is less likely. Okay. Predominantly تكون unilateral. Predominant unilateral. والpatient عندنا bilateral. Precipitated by both trivial movement or forceful contraction. So it's mainly with movement. والpatient شو يقول؟ Relief by movement. So ما تمشي مع idiopathic muscle cramp. Okay. Visible or palpable muscle noting يعني ممكن تحسين كذي كأنه في note of muscle spasm. Okay. Good response to passive or active stretching. لما يسوي stretching يقول لك أنا أحس إني أرتاح. زين. هو عادي من يمشي بيحس إن الأمور أحسن عنده. Okay. Normal neurological examination يكون عندهم ويكون normal general physical examination ما عندهم أي مشاكل. لما يكون في عندي كرايتيريا مو ماشيه مع هالكرايتيريا اذا انا more toward ان this is could be a secondary not an idiopathic muscle spasm and I need to rule out these secondaries. ولما اقول secondaries معناته شنو؟ triple diagnosis. لازم I have to rule out physical, I have to rule out social and psychological. Okay. إذا عرفنا هذه الكرايتيريا as a first line of intervention and it's not there, then the other part of our PICO is to use the secondaries and to look for it. And if we look for the secondaries, the most common reason, I will just put it for you. عندنا structural like اللي عندهم flat feet أو أي مشاكل في القدم تكون structural deformities ممكن تكون سبب. أو اللي يكونون prolonged sitting or inappropriate leg position اللي يكونون مثلا خصوصا اللي يكونون مثلا يحطون رجلهم بوضع معين شافسينها او شيء ممكن يسبب لهم وممكن هذا شوي ما يكون عنده زين او living على concrete flooring ينام ويقعد على ارض كونكريت. هو طبعا عايش بالكويت الحمد لله ما عنده المشكله يعني الحمد لله الوضع هو زين. يمكن لما كان هناك في افريقيا يمكن ممكن يكون هذا reason. اوكي so we need to ask لان بس هو شنو قال بعد ما رديت بدأت أحس بالمشكلة. أوكي. طبعاً نيرولوجيكال مثل باركنسون، مايوباثيز، نيوروباثيز، راديكولوباثيز اللي يدخل معاها اللي هي السياتيكا والموتور نيرف ديزيز. ميتابوليك مثلاً اللي يسمون دياليسيس ممكن يكون ريزن pregnancy related cramps أو other metabolic like diabetes, hypoglycemia, hypothyroid, low calcium, low potassium هذول كلهم ممكن يسببون muscle cramp. Okay, medication and these drugs they have a strong يعني maybe can cause a cramp but it's still not proven. This is according to the up to date. Not proven relationship with the muscle cramp like the inhaled long acting beta agonist, potassium sparing diuretic, thiazide diuretics, loop diuretics and other beta blockers والاشياء هذه. They did from the up to date. They didn't show a strong evidence that they can cause muscle cramp. Okay. And other like exercise, as you said in the beginning, is it an exercise related? and it comes after the exercise? Is it peripheral vascular or other less common causes like nocturnal leg cramp, including anemia, Renal syndrome, opioid withdrawal, cirrhosis, or bariatric surgery. طبعا bariatric surgery يمكن قالت قبل شوي مريم اللي يصير عندهم mal absorption واكثر شيء احنا نشوفه بسبب السليب. Okay, but it's a very important question to ask if they did any surgery.
So now we ruled out the physical reasons. First of all, we ruled out that it is an idiopathic muscle cramp, and then we ruled out the secondaries. And of course, because always we take the holistic approach of our patients, so we looked out at the other reasons like the social and psychological, which include anxiety and depression. This table from up to date 2013 helps you to differentiate between the two disorders, between depression and anxiety. The first part gives you the symptoms, which is specific for depression, and then the symptoms which are common between anxiety and depression, and the symptoms which are specific for anxiety. And this would help you to differentiate both, which is very important because they looks like that they are similar, but there are some symptoms which are very specific to each one of them. So you will try to rule out depression first, and this is by asking the two major criteria, which is the low mood and the loss of interest. If these two are positive and the duration is more than 2 weeks, then you will go for the minor criteria to know the severity of the depression. If these two questions are negative, then most likely depression is not present, and you will go for the questions which are specific for anxiety.
ونفس الشيء حتى بالانكزايتي we have two questions اللي هم الرولينج اوت اذا كانوا موجودين نحدد السيفيريتي. كان بالنسبه for this patient عنده positive في البدايه اللي هم two questions اللي هم شنو؟ بالانكزايتي هو الدبريشن احنا قلنا ما عنده loss of interest ما عنده low mood. بالانكزايتي اللي كانت positive عنده
restless
excessive worriness excessive اي اول جدول ان the first two plus اللي تحت فيعني هذه تكون excessive anxiety and worry occurring more days than not at least for the last 6 months for the last 6 months انه يكون معظم الوقت هو قلق و worried about things. okay, the individual found difficulty to control the worry يكون عنده قلق وتوتر وبالاضافه لذلك انه ما يقدر يتحكم في هذا القلق والتوتر بالاضافه الى باقي السيمبتومز. فبس بالبدايه لازم يكون عنده على الاقل these two. اوكي بعدين الانكزايتي and worry are associated with 3 of the following. اوكي على الاقل يكون عنده 3 من هالاشياء فيكون عنده restlessness or feeling keyed up or in the edge يحس دائما انه هو خلاص على اعصابه وبسرعه راح ينفجر وهالامور. being easily fatigued بسرعه يحس انه هو تعبان. difficulty in concentrating or mind going blank, irritability, muscle tension, sleep disturbance. هو عنده واحدة منهم اللي هو المسل تنشن وكانت سوت له هي الجاد 7 وطلعت باجيهم انا ما ادري شنو بالضبط اللي كانت طلعت من هني زي ما
الجاد 7 ديفرنت شوي.
اي ديفرنت راح احطها الحين. اوكي بس هذه هي حق البرايمري دايجنوستس. انا راح اقول لكم بالنسبه للنايس جايد لاين they compared between using these symptoms and using the GAD 7 and which one is better. Yeah, actually this is what is also a nice guideline. هذه السيمبتومز هي فور جنرال. انت الحين ما عندك الجاد 7 ولا قادره انت تشخصين فهذه you use it as a clinical screening for الانكزايتي. لكن the best way to do it for screening and diagnosing is the GAD 7. اوكي طبعا هذه كلها symptoms لازم تكون تكمله الاعراض. The anxiety and worry physical symptom cause clinically significant distress or impairment, social life, occupational or other important areas of function. فإذا لازم يكون هذا الشيء مسبب له أثر في حياته. وهذا اللي قالته لنا دلال إنه فعلا هو متأثر في حياته حتى شغله مو قادر يسويه. Okay. The disturbance is not attributed to physiological effect وهذا اللي حاولنا إن إحنا نستثنيه إنه ما كان في physical reason. It is not better explained by other mental disorder. يعني ما يكون هو depression، ما يكون هو أشياء ثانية. Okay. Because the majority of anxiety symptoms are not specific to GAD, it is important to exclude the other anxiety disorder before making the diagnosis. هذا هو according to NICE guideline 2012 اللي هو الGAD 7. طبعا لما يسووا comparison NICE guideline between ان احنا نسوي clinical diagnosis using the questions اللي حطيتهم في البداية او to use الGAD 7 لقوا انه better to use الGAD 7 for diagnosis. بس اذا هو مو متوفر عندك على الاقل the first two questions انت تقولين this is anxiety انه that it needs to be tackled. اذا هو worry most of the time about something in his life and it is for the last 6 months and he cannot do a control of this worry. If these two هذا يسمونه GAD 2 if these two اللي هو GAD 2 positive then you should do GAD 7 اللي هم هذول الأسئلة وني تقيمينه على أساس إنه هو 5 ولا 10 ولا more than 15. أوكي. ممكن تكون post traumatic مثل ما قال الدكتورة مساء ممكن تكون post traumatic stress disorder. شو رأيكم ممكن ولا مو ممكن؟
ممكن. هو having
وعنده
flashbacks.
flashback. عنده flashback من ها؟
This flashback causing avoidance ولا شيء ولا؟
بس فلاش باكس يعني ما تكون continuous daily.
لا هو
post traumatic.
اي
يعني هو عنده daily.
هو daily.
post traumatic usually ما تكون daily، تكون بس يعني
occasional. اي
في nightmares or whatever.
هو
He wasn't having nightmares بس كان عنده flashbacks و thoughts.
اوكي. فطبعا for appropriate diagnosis of post traumatic طبعا هو مو ماشي معاه وايد بس علشان to do better diagnosis they recommend to use a special 30 questions في انا حطيت لكم اللينك هني you can use it for better diagnosis. They are 30 questionnaire he can answer it and by this you can rule it out. طبعا هو لما تحول علشان to rule out is it GAD or post traumatic لما حولته دلال وهم they did for him they found that it is more toward انه هو يكون GAD okay and not post traumatic لان اصلا حتى التروما اللي جت له يعني مو انواع التروما اللي تسبب post traumatic.
اعتقد الفلاش باك اذا ماني غلطانه يكون فيها حتى physical symptoms
palpitation وسويتنج له كرايتيريا معينه ما
بس انه يتذكر
بس يتذكر عشان كذي مو ماشيه معاه كبوست تروماتيك. بس علشان تكوني انت more firm in the diagnosis you confirm it better to use the questionnaire عشان to rule out if this is post traumatic ولا هو GAD. Okay. ف the take home message that we want from this case, the first thing when the patient comes to you with muscle cramp, always think about the idiopathic muscle cramp. Okay. If you exclude it وشفت انه لا ماشي انه it's not idiopathic, there are things in the criteria that say that this is not idiopathic, then you would go and look for the secondaries and it is always the triple diagnosis, physical, social, psychological, and we have to know that it is mostly clinical. يعني we don't need to do many investigations or any too much physical examination. We mainly need the history. هذا يرنحك سؤال أنا كنت بحطه فيكم بعد بس أنا قلت ما بأسوي confusion. كان من الأسئلة اللي في بالي إنه use of Norgesic as a muscle relaxant as a first line treatment for evidence. وممكن يكون هذا السؤال حق مرة جاية إن إحنا we look for the evidence of using Norgesic as a first line treatment in muscle spasm and how effective it is كevidence. سؤال رانيا عن سالفة إنه والله مثلا إن muscle spasm will be relieved with the muscle relaxant ولا لا؟
بس في شغله انت الحين البيشنتس قاعد تعطيهم مسكدول، البنادول هو بروحه بين كلر ممكن يكون تاثير البنادول
انا بس ما لازم ننطر هي شنو المسج؟ ما لازم ننطر ان البيشنت ياخذ دواء علشان انا اقرر ان this patient needs to look further for secondaries او لا. لازم من البدايه مثلا انا البيشنت جايني وعنده pain muscle cramp for an hour. This is not idiopathic. ليش انطر اعطيه muscle relaxant واشوف النتيجه عشان اقول ان انا I should look for. This is a way to reach a diagnosis. Wait and see. انه we start medication and wait and see. صح؟ متى استخدم this way؟ متى استخدم this method اللي هو انا I give treatment wait and see. لما اكون انا حاطه most likely professional diagnosis وعلى اساسه I started the treatment. مو انا قاعد اعطيه treatment blindly واقول اذا تحسن ولا ما تحسن. فهمتيني؟ يعني المفروض ان انا اول شيء يكون عندي professional diagnosis حاطته في بالي وعلى اساسه بديت العلاج. فاذا كنت انا حاطه professional diagnosis ان this is idiopathic وهي مو ماشيه مع الايديوباثيك المشكله من البدايه اصلا. صح؟ فانا this way of wait and see I use it. بس متى؟ this way I use it مثلا انا حاطه possibility this is a bronchial asthma وعطيته treatment as a bronchial asthma and I'm looking for the response. بس انا حاطه most likely انه bronchial asthma. most likely انا ابدا treatment. ترى يا جماعه بدايه treatment تخلي البيشنت you are not changing his health seeking behavior. البيشنت راح يكون attached to a behavior. راح كل مره يقول عطوني المره اللي طافت هالدواء ما فادني وايد بس يلا خل اخذه. ويظل البيشنت يعني a bad behavior ان انا اعلم البيشنت. فويت اند سي ممكن انا هذا اقول له لا I will wait and see بس without a drug. ممكن. لكن انا ابتدي له من البدايه drug وانا عارفه ان this is most likely not an idiopathic. ما صدق.
عندنا يعني ما ادري بالنسبه from my personal experience على الاقل انا الاحظ ان most of the patients are bad historian maybe because I did not take the history properly. انا يعني ساعات في مهارات التواصل لما تسألي السؤال you make it open ended question. لا تسألي السؤال بطريقه تخلي المريض يعطيك الجواب اللي انت تبينه. ساعات يقول لك لما تقولي له العوار ايش كثر طول معك غير لما تقولي العوار طول يقول لك ايه ساعه. عرفت شلون؟ فانت يمكن لما يعني يمكن الشغله اللي تسوي كونفيوجن عند الدكاتره انه هو ما راح يعطي الهيستوري ماله اكزاكت. هو يحب يبالغ. زي ما احنا سؤالنا احنا في الاساس كان هو الواي اوف في المبالغه. يعني فهمت علي ايش قصدي؟ انا وصلت اللي انا
يعني انت اللي تبين تاخذين من البيشنت راح تاخذين بطريقتك.
ممكن يختصر لك الهيستوري اصلا. هو يقول كلام من نفسه.
Thank you for being with us. Please always check the links in the description of the videos. Subscribe with us if you would like to know about our future videos. If you like this video, please put your thumb up, give us comments and share it with others. Thank you.